Newsfirst, Newsline.
Very good evening to you. You're watching Newsline. I'm Chathuranga Hapuarachchi. I'll be taking care of you for the next half an hour in the absence of Farah Shaukat Ali. Today, there has been developments with regard to COVID-19 in Sri Lanka, and we are going to talk to Dr. Ashan Pathirana from the Health Promotion Bureau regarding these developments, these updates, and what they actually mean. Thank you, Dr. Pathirana, for agreeing to be on the show on short notice.
It's always a pleasure.
Let's get to the point straight away. Third wave has been announced. We know now that there won't be a lockdown during the long weekend, and certain scary information has come to light that young people get affected. There is a new S gene that everyone is talking about. A lot of information that the public may have known about other countries in the world, but not about Sri Lanka. And now it's happening here in our own home. So let's start there. What is this new gene?
So it's not actually new gene. This gene is something that we are detecting on the spike protein. So there are mutations that are taking place. So once those mutations come in, so sometimes it's difficult for the body to detect it, because see, the vaccines that we are developing are targeting this particular spike protein. So when there are mutations coming in, there's a little bit of uncertainty about whether these vaccines or even people who got the previous infection, whether they are still susceptible. So that's why this detection problem is there, and it affects our PCR facility as well, because we are looking for that particular component. But I think you heard previously it was announced that we are getting down the new PCR kits that are capable of detecting the mutations as well separately.
Doctor, I know you're from the Health Promotion Bureau and there is a certain limit that you can provide answers to, but I'm going to ask you this anyway. For everything that happens, especially when you take a look at the vaccine, when you take a look at the decision to conduct PCR test or not conduct PCR test, with regard to the rapid tests that were done as well, and now bringing down PCR kits to test for this new S gene, aren't we a bit late when it comes to all of this? Aren't we a bit behind? Are we taking decisions later than we should take the decisions?
So actually it's a good question, because see, what you see is, like, always we come late to the party, but the thing is we have limited resources. So people complain about lack of testing and all, but you have to understand the people who are actually doing the PCR, who are taking samples, were the same people who are doing the vaccination program. So at the end of the day, we have to manage that resource in a way that we get the maximum out of it. So yes, things are slow down, but that doesn't mean that we just let it out. Right? So what we do is we have proxy indicators. So we do check all the so when there's a dead person, like especially in the Western Province where we have had the bigger outbreaks. So what we do is we usually test everyone with a PCR, and in that instance, if we see that there is a trend that the number of people who turn up dead and they are becoming positive, then we know that the trend is going off. Then if we are getting more respiratory illness people, so we have the surveillances. So when we pick up that there is a change in the trend, what we do is then we announce. So that's what we did from the Health Promotion Bureau. We put out a red notice about 3 days ago, saying that we have observed a difference in the trend of people turning up. So younger people are coming up. So then the people who got admitted required intensive care unit. So then those are the pre-signs. So as you said, are we in the third wave? Well, that's still questionable. It's up to us whether we are going to make it a third wave, or whether we can, do this thing right here, right now.
Doctor, interestingly now, there was a vaccination process in the country. About 900,000 people, over 900,000 people received the vaccine, and a majority of it initially were military officials, police, and doctors and other health services employees. Now, we didn't have a second dose. There were problems regarding it, and we know now that India is having some sort of trouble with regard to the COVID numbers, and there might be further delays. But the decision to not provide the second dose to at least the health workers and the military, has this resulted in any way? Because now we say that it was due to the New Year time frame that people got this going, this situation, and we also know that it is a large amount of the military people who are actively working very hard to protect the people have to go back home during the New Year season, and again this inoculation process has had trouble. We've delayed the second dose. Has that resulted in this possible third wave as we claim it now?
So that's a really good question, because see, what we have to realize is just by taking the first dose itself, it gives a considerable protection. So anybody who has taken the first dose has considerable protection than a person who has not been vaccinated.
Sure.
So the thing is, we need a booster so that the immunity gets kicked up to a certain level that it provides long-term protection. But if you look at the data, in Canada, what they have done is they have extended the second dose to 16 weeks. So the information is still coming in. We might even further delay it if it is good. So there is no such issue saying that, okay, if you don't take the second dose on time, the first dose will be in vain. No, it's not like that. But like if the immunity waves now off for a while, then there'll be a small susceptibility that might develop later on, not now. Because the evidence clearly shows that the people who got the first dose, there's a time gap of 12 to 14 we are talking about, but Canada is saying it's 16 because the evidence is still rolling in. So no, it's definitely not due to that. Not because the healthcare workers, because we haven't seen any relationship with the cases that are coming up to people from the military or the healthcare workers getting linked. So it's not.
Doctor, again, we'll dwell about this vaccination problem and then move on to the other parts that I want to discuss with you. The vaccination is coming from India, from the Serum Institute, and majority of it, or if I'm not mistaken, the entire lot of it was free of charge. Covishield, the program or the WHO provided a certain portion of it, and the Indian government provided a certain portion of it. There are other vaccines also coming into Sri Lanka. There is a Sinopharm coming in, which is still pending an MRA approval. But the vaccine, the AstraZeneca, the one that the people in Sri Lanka received thus far, had come free of charge. But now, if India says we cannot provide it because we have an internal issue, we have to purchase vaccines from another country. Firstly, I spoke to Mr. Lalit Veeratunga today at a press conference where he said we have the money. Money is not the problem. Do we have the means to do it? Can other countries provide us the vaccine?
Yeah, I think we already placed an order with the Indian government because of the fire that took place and to the obvious reasons. Like say, India is having a very bad outbreak. I mean, we have all seen how bad things can get. Like that's like the thing that really scares everyone. So during this situation, we can't expect India to, to be all altruistic and start sending vaccines abroad and not look after their own people. So in that situation, we have to accept that India will definitely prioritize their own people. Absolutely. So that's the situation. If we don't have vaccine production within the country, we have to depend on an third party. And they will always ensure that their financial gains are ensured, either their political leverage is taking place. So there's something that it's not just the money, right? Especially in a situation like this where the supply is not that strong, right? And only a few have been approved up to now. So we have to consider the fact that we might have to stay for a while. But then again, it doesn't mean that the other vaccines are bad, right? Even Sinopharm, right? Even though it's not approved in Sri Lanka and the WHO approval is not there, there are countries that are still giving it. So countries like Dubai, which have strong systems, where they have done the third phase clinical trials in that country, they were quite confident and they're going ahead. Most of their vaccination program has taken place with the Sinopharm. But then again, we are making sure that our data is available for us to make a decision. So Sputnik is being given in Russia, but again in Sri Lanka, that's another option that's out there. So yes, we do have the options, but for the time being, even though Sputnik and AstraZeneca theoretically can be combined, and there's research going on about whether it could be matched, the evidence is still not there for anybody to recommend that. So we have to get the second dose with the Covishield, and let's see. Doctor,
about the AstraZeneca vaccine, this whole thing about the blood clots and people having various complications with regard to it. The health minister spoke in the Sri Lankan parliament and she also said there have been certain complications that were reported in Sri Lanka as well. I have two questions. One is whether the people who received the vaccine thus far, what should they be worried about, if at all? You hear this, but you never know because this is new. It's not, even if I had the vaccine, I don't know how I find out whether I have any complications regarding that. That is number one. Number two is, we cannot forget that this vaccine is free of charge, and as we discussed, this is a business. And in a business you tend to eliminate your competition, and a free competitor is going to be a problem. So whether AstraZeneca is the fall guy or the victim of this pharmaceutical game is my second question.
All right. So let's start with that one, because that's the interesting one. So yes, there are issues with the blood clotting thing. That's the first answer. But it's extremely rare. So if you talk about drugs, any drug will have side effects. So there are long-term ones and there are short-term ones. So you ask the question, so if somebody gets the vaccine, what are the things that you should look out? So the first thing is the allergy issue. So the allergy issue will come within the first few like minutes to hours. So once you're out of it, you will have the usual the body aches or sometimes fever, like the chills. So so if that goes on, and then these things come a bit later on. So this clotting issue. So they're saying it's like, so you can see small bleeding patches or anything that indicates that there is a bleeding issue, severe leg pain. Also, we will advise in time what to look out for, but those are extremely rare. But if you really look at the outcomes of COVID itself, the amount of clots that are being formed and the havoc that it can unleash, so the cases are about per 100,000 you will find one guy having a clotting issue, and out of that, that doesn't mean that person is going to succumb to it. So now the research is out, we know why the clots are happening, so the treatment is also available. So compared to what we are dealing with, and even paracetamol, if you consider, if you give it to 1 million people on a given day, some people might develop liver failure or an allergy. So we are just talking about this thing. Then coming down to the thing about AstraZeneca being a not-for-profit vaccine. So it's been developed by one of the best vaccine manufacturers, AstraZeneca, plus the Oxford University, and it's been given as a not-for-profit vaccine. So it comes very cheap, and that's probably the option for most third world countries and the people who are not having. So there can be other wars, include like people who can afford will always say that the ones that are expensive and produce in their own countries. I mean, who wants a guy to just jump into an open market and disrupt it? This is just all conspiracy theories. But then again, like AstraZeneca is the one that's there on the option, the table for us. So it's affordable, right? There are other vaccines that are coming in. But then again, so make your decisions based on the rational thinking, whether the pros and cons needs to be weighed, and it's heavily on taking the vaccine. I would take my second vaccine for sure.
News First, Newsline.
Welcome back. You're watching Newsline. Before we head into the break, we discussed about the AstraZeneca vaccine and all these conspiracy theories surrounding it. Now let's get back to Sri Lanka and the Sri Lankan situation. Dr. Pathirana, the death toll or the fatality of this new incident, new development that we are seeing, we saw an increase of patients from especially the 17th. Is there a change in the fatality rate, or has that been measured? Can people say, yes, there are more patients, but there are less deaths reported? Is that a way of looking at it, or how do you look at it?
Okay, so to say it confidently, we have to have the statistics in, and we are doing the genomic sequencing. Probably it will take at least about a week for us to have conclusive evidence to say whether it is due to the new variant or what it is. But what we are observing right now is a tendency where the people who get admitted require more respiratory support, and the younger people who are considered like sort of immune to this, and people had this attitude that, okay, I'm young, I'm healthy, I won't get it. So that attitude, I think it's high time that we drop it, because we are seeing more younger people getting affected. It could be due to several reasons. One reason is they were not vaccinated world over, and they are the most susceptible now. And on top of that, they were the people who were mingling more. They were going out and meeting others, so that makes them more susceptible. But then at the end of the day, they are susceptible, they are prone to the disease. So any young person watching the show should realize that they are equally susceptible to get the complications and end up in hospital. So we have to take every possible measure to curtail this.
Doctor, what about the number of beds, number of ICU beds, the availability of oxygen supply? Now people are also talking about this, because we saw this in the past, especially the second, at the end of the second wave, people are talking about the ICU beds not being available. Then the army had to come in and they made available certain facilities. But now again, if you're looking at a possible third wave, we have to discuss this. So what do you know about the situation in terms of the ICU beds and the availability of oxygen, if you say that breathing is a problem?
Yeah. So in Sri Lanka right now, we don't have an issue about it. Like, so we are prepared, but then again, we are still at the very beginning of this outbreak. So we can't really say that, okay, we have everything sorted out. It's not like we have an unlimited supply. That's why we are urging the people to take every possible measure during the coming days to make sure that you do not walk out of your house unless it's essential. Right? Don't go into crowded places, follow the basic protocols, and like the hand washing, the distancing. Even when you go to a place, try to make it as short as possible. Try to stick to open spaces than confined spaces. All of this needs to be followed. And I think the issue about the airborne spread, it was taken up. So yeah.
Doctor, now I'm getting a few questions from our viewers, and we thank our viewers for those messages, but I'm going to amalgamate a few of these and ask you a rounded question. Now, we spoke about the different types of vaccines, but in Sri Lanka, if the virus itself is spreading like this, if we knew about all of this, we are talking about the health sector, a bunch of educated people making decisions. If we knew about this, and if we saw the New Year season, this was coming, yes, imposing a lockdown wouldn't have been the option because the economy has to run, but there could have been other precautions that could have been taken, which we avoided altogether, not just by the authorities but by the people as well. And now blaming it, because why I'm asking you this question is, I'll give you an example. We decided to do PCR tests to the public, and we bought the rapid kits as well. But at one point we did not know whether that was happening for a long period of time. And now again we are going back to that same system where we are testing the people again. So if we continue those precautions, these simple things that could have been done, couldn't this have been avoided?
Yeah, so Chathuranga, good question. I think we started off with the same question. Like, so we have limited resources in terms of human resource who are doing the testing. So the PHIs and the MOH system in the country, they are doing the vaccination plus the PCR testing, taking the swabs as well. So yes, at one point we had to compromise. So we were focusing more on the vaccination process, and then the PCRs, the testing gradually went down. But that doesn't mean that, okay, we didn't ask people to just take off the masks and walk around. With the health ministry kept on telling, these are the precautions, even during this season you have to stick to them. But we have to realize we are dealing with humans, not robots, right? So at the end of the day, these people have been suppressed for a considerable time. And I think the Army Commander rightly explained today that due to the bombing, the April bombing, once the New Year didn't take place, then the last year due to COVID it was obstructed, and now again, so there are social issues. So the health ministry, what we can do is basically give our input on it. So we are just one part of the whole system. So in terms of the sociologists and the political, they have to make the call on behalf of the government to decide whether you are going to enforce strict lockdown measures or whatever. So,
Doctor, you bring us to an interesting point, and that leads me to the next question. Now, while we encourage the people, while the health authorities, educated people such as yourself and whoever is handling this situation, encourages the people to wear masks, asks them to do various things to protect themselves. But you switch on the TV to watch the news, and you see parliamentarians brawling in parliament without any health precaution whatsoever. They carry on their lives like normal, and these are people who the general public look at, especially, as you say, young people. And so you are saying one thing, the parliamentarians doing another thing, both contradicting. How does this look? I know I promised I won't ask you political questions, but this is a genuine question.
So this is what I'm saying. So as people, what we expect them is not to follow anyone else, but like we expect people to be educated. So that's the best we can do. We don't follow anyone. We don't like pick role models from the parliament and start following them. So what we want, people are very critical about, like even sometimes doctors or any other person. So be objective, right? We are not setting role models here, right? So what we're talking about is we are giving health guidelines. We are giving the instructions. Anybody who's rational and who can think straight will understand the guidelines given by the health ministry are quite clear. And even with the new variants, there's nothing much to change, right? Basically, you have to follow the same guideline. If people ask, do we have to do anything differently? No. but stick to the guidelines that have been, and people have done a good job. See, like, you can't just blame the people saying that they have not done. That's why we were able to bring this under control. But it's just, we are just like anything, once you have been constrained for a long time, and when the burden goes down, people naturally start enjoying the freedom. But then again, now it's time to tighten up the belts a little bit again and go back to the basics, do what we've been doing right, do the health precautions right, and we should be able to, stop this third wave. I don't say that there's a third wave.
You're not.
Well, it's starting.
It's
whether
starting
we allow it to become a wave or we just kill it at the beginning is up to us.
Doctor, a lot of questions are coming in with regard to the conduct of the Parliament. I'm not going to bother you with those questions, but I'm going to move away and ask you, there are certain, a group of people who would still worry about getting the vaccine. In terms of things that they should know, the things that they should be aware of, in terms of things that, for example, if I have this particular condition, I shouldn't take the vaccine. Are there any information like that available? If it's a lot to speak about, if you can guide them onto your website or something, that they can go and read it there, is there that information available anywhere?
Yes. So the Health Promotion Bureau maintains the website, plus we have a wide presence on social media. So we have about more than 500,000 followers on it. So I would encourage people to actually join, so that we will update you with the real thing, that's what's going on, and what are the latest updates, because the misinformation is really bad in Sri Lanka. So that's one thing that we need to tackle. So yes, we have all the instructions, and especially the people who have non-communicable disease, who are actually scared, with heart disease, cancer, they are the people who should take the vaccine, because they are at a very high risk. If they contract the virus, then there's a very high risk that they will succumb to it. So more than others, people with non-communicable diseases should take it, even in the younger people who are getting affected. The ones with the non-communicable diseases are the ones who are actually more susceptible here. So we'll have to talk about that separately, about the lifestyles about.
So the Health Promotion Bureau website is
HPB. So if the easiest is what people do is go on Google, just type in Health Promotion Bureau, you will get it.
And go to the first link that you find.
Even on Facebook, you can follow us.
Yeah, we urge our public to have a look at the material that is available. There is a lot of material that is shared by the Health Promotion Bureau that we, through the media, also share onto various platforms, but direct access is given from the Health Promotion Bureau. A lot of answers to the questions that we have on how to get the vaccine, what we should worry about, things like that are answered mostly on the Health Promotion Bureau website. So thank you for the service that you do there as well.
Awesome.
Finally, we have been asking this question from last year. We knew various people said, it will end on this day, it will end on this day. But here we are again, almost a year and a half later, talking about the same thing. Is there, at least for Sri Lanka, at least in the short run, do we see light at the end of the tunnel?
Well, Chathuranga, like, the first thing is we have to at least get the vaccination done. Then we have to think about the possibility whether the mutations are all covered with these particular vaccines, because the mutations are coming at a rate. So yes, the first thing is we have a good weapon in our arsenal to fight this off. And hopefully, if once we get the entire country vaccinated, there is a chance that we will come out of it. But given the rate at which the mutations are coming in, we might have to go for a booster dose that will cover the mutated versions. But then again, for right now, these vaccines provide fantastic cover. So we talk about efficacy, but more than that, the people who have taken the vaccine have very, very low chance of having an illness that will require hospital admission or going into complications. So the vaccine is the key. So once that is done, we can go into an evaluation. But then again, taking the vaccine is the most important thing while we look after ourselves till that point.
Doctor, finally, if let's say we don't get the Indian vaccine, the AstraZeneca vaccine, now a lot of 900 odd people have got the first dose of it. What do we do?
You mean like for the second dose?
Yeah.
But
so what happens to the first dose anyway? Can we take two of another thing?
Oh yeah, we can. Like, there's no issue with it. It's not like it's gonna affect us badly. But the thing is, for this particular vaccine to work, we'll have to take it with the AstraZeneca. That is what is recommended.
Right.
But this is a viral vector vaccine. Sputnik 5 is again another viral vector vaccine. There are research that have been done to see whether you can combine, but it's not approved and it's not currently been recommended. But then again, those possibilities possibilities might be there, but for now we will push to get this second dose somehow, because the WHO is also supplying us not only from India but from AstraZeneca itself. They have pledged a certain about 25% of the vaccine, so even that might come in on time for us to cover the second dose.
So what we know now is that there is a certain expiry date on these vaccines, and certain portion of it is expiring in June, and another portion in another part of it in July. So what we know now is to get it in smaller quantities, 250,000 doses in one go. So does that mean that there will be another new set of guidelines for how the vaccination will happen? Because we saw once a guideline was issued, but that was not followed. It was done in another different way, and again it went back to that old system. So are we aware of what's going to happen if the vaccines arrive?
Yeah, so the vaccine schedule, like the vaccination program, is the same. So it's the same protocol that will be followed. I think the change was from 4 weeks we went to 12 weeks. Right now, if the evidence comes saying that it's good after 25 weeks, we'll go for 25 weeks. Right. So the evidence is just coming in.
Thank you, Dr. Pathirana. That's all the time we have to discuss about this. But next week also we'll be focusing a bit about this situation in the country. Once again, thank you for being a part of the show and talking to us about the new developments. That's all for the show this evening, but stay tuned to News First to watch the prime time English news. We have several more updates about this situation. I'm Chathuranga Hapuarachchi. Take care.